Hello everybody and welcome to the Tuesday edition of Video Clips, and as usual we will start with some announcements. First of all, every Wednesday we're posting stuff on the members site, and this Wednesday, Cooking with Chef Del, it's Eating More Beans Part 2. Del can do amazing things with beans. Sauces, desserts, things that you wouldn't even think about that you can make with beans, and we get to eat a lot of that stuff around here. Recommend it highly. Advanced study, I started this last week, but you can still join in because we still have the recording of the first session. It's on Dr. Kelly Turner's amazing book called Radical Remission, about people who survive literally a death sentence with a diagnosis of cancer. Amazing book, and I got a whole lot of emails from people who listened to the first part of the program last week and said, I don't have cancer, but boy did I learn a lot about how I should be living my life differently, or I have cancer, I have a friend with cancer, and my gosh, is this helpful information. So next workshop is next week, and if you want to join us, just call the office. Ask Dr. Pam is tonight, and I do that once a month. You're welcome to join us for that. School started yesterday, but not all of the classes start the first week, so you can still join us to take classes at the Wellness Farm Institute if you would like to learn more about health and nutrition and medicine. All right, two topics I want to cover today. The first one has to do with children and their ability to choose food. According to a new study, kids between the ages of 3 and 5 are already aware of which foods are healthy and which aren't. Unfortunately, however, their knowledge level and maturity level are not sufficient to translate that into constantly making optimal choices for themselves. So I'll tell you about the study, and then I'll tell you what I think it means we need to do. The study involved 172 children in Ireland, and it was designed to look at how kids determine if foods are healthy or unhealthy. The good news was most of the kids were able to correctly identify healthy foods like fruit, vegetables, and potatoes. They were also able to identify unhealthy foods. The problem was, the lack of understanding, was that they really didn't understand that they weren't supposed to eat so much of the unhealthy foods like French fries, candy, and soft drinks. Lots lower comprehension on that. And their awareness, by the way, interestingly enough, was not related to things like family eating habits or television watching. They seemed to know good foods from bad foods. So the researchers concluded that the results suggest that it's important to teach children about less healthy foods in the preschool years. I agree with that. But here's another take-home point from this study. This is why parents and other adults need to make food choices for children most of the time until they have developed enough maturity and knowledge to make good choices on their own. Now, I think most sane adults realize that preschoolers can't be offered a choice to stay home and play for the rest of their childhood or go to school, right? We tell them you have to go to school. They don't get to choose their bedtimes. They don't get to choose which television shows to watch. But it is amazing to me how many adults who are clear that parents need to intervene in this type of decision-making aren't really clear that kids need to be given similar direction or even choices made for them when it comes to the food. So my take on this is, why don't we do some more nutrition education, but combine that with strong parental and adult decision-making so that these kids are molded into ability to make decisions about food on their own. Okay, second topic for today, ongoing discussion of psychiatric drugs. And I'll just start by making the statement that covers all drugs, not just psychiatric drugs, which is that drugs and procedures appear to work, many times because patients are only followed for a real short period of time. So there are likely to be improvements and not enough time to show the detrimental effects of the drugs. So data on short-term trials leads both doctors and patients to think that drugs are a whole lot more valuable and safe than they actually turn out to be when we have more data to look at. So by way of example, in 2013, a team led by Dr. Lex Wondering looked at long-term outcomes for patients who were taking antipsychotic drugs for schizophrenia and other related disorders. The researchers looked at patients 5 years after they had completed a 2-year trial. Now, in the 2-year trial, patients who were taking antipsychotics were randomized to either continue drug therapy or to stop taking the drugs after 6 months of remission from symptoms. Patients who stopped taking the drugs had a higher relapse rate than the ones who stayed on the drugs, and that's consistent with the short-term studies out there. Well, Wondering's team was able to locate 103 of the original 128 patients. Most of them were still taking drugs, but 34 had stopped, 22 in the original discontinuation group and 12 in the group that was supposed to keep taking the drugs. Now, It was very true that the relapse rates were higher in the discontinuation group at 2 years, but by 3 years, the group was about the same. Symptoms were reduced in the discontinuation group while they increased in the group who were taking the drugs. So the authors speculated that perhaps the drug maintenance strategy postpones relapses, but it doesn't really prevent them in the long term. Additional data. More patients in the drug reduction group had achieved functional remission than the patients who were taking the drugs. Now, functional remission is described as the ability to maintain daily living, self-care, work, school, and relationships with others. More than twice as many patients in the drug withdrawal group had recovered, defined as symptomatic and functional remission for at least 6 months, as in the drug group. Now, there is a growing body of evidence that shows that even severely mentally ill people do not benefit from drug treatment. One thing that sort of astounded me is in Anatomy of an Epidemic by Robert Whitaker, he talked about in some areas of Finland, the term schizophrenia is virtually vanished from the language. And the reason is that groups of therapists go to the homes of patients who are having delusions and identified as schizophrenic, and without drugs, work with those patients in their environment to help most become functional within a fairly short period of time. And very few drugs are used, and they're used pretty judiciously. Drugging people who have psychological issues, in my opinion, it's the latest in the psychiatry profession's long string of failed and barbaric treatments, which have included electric shock and frontal lobotomy. Think about that for a minute. At one point in time, this group thought that the thing to do to cure mental illness was to give people a frontal lobotomy, and they did that. Psychiatrists latched on to this biological model of mental illness because they thought it could save the profession and gain some respectability. And prescribing drugs and after short visits with patients would make them look like real doctors. Now, I'll tell you who I think the real doctors are. You might remember a couple of weeks ago I talked about groups of women who were given minimal training and did therapy groups in places like Uganda and Pakistan and achieved remission rates for depression as high as 97%. You know, the psychiatry profession has never come remotely close to what these women with a couple of days of training have been able to do with their peers in that environment. So exposure to psychiatrists, in my opinion, is just one more hazard associated with living in a wealthy, westernized country. Now, I don't have it in for all psychiatrists. Obviously, I have good friends who are psychiatrists who do not practice biological psychiatry, but I'm talking about the profession as a whole. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you Thursday with more news.